Good afternoon, and welcome to this session entitled Who Do We Use This Time? A discussion on the current GPO landscape and contracting in the reform era. This session is focused on GPOs and contracting, and we hope that you find it both informative and timely. For many of us, the last 18 months have been interesting, to say the least. We have seen health systems start their own regional purchasing collaboratives and GPOs. We've seen major health systems transition from one GPO to another, and even at least one health system go out and buy their own GPO. GPOs have merged business units, spun off business units and software systems, and bought other GPOs. One of our speakers in the recent CQO Summit went so far as to say that he has seen more activity in the past 3 years than in all of his 44 years previous to that point. So when you place all this activity within the framework of healthcare reform, many of us find ourselves wondering, now what? Where do we go from here? Or more importantly, how can our facilities reach out and harness the capabilities and expertise offered by the GPO and regional purchasing collaboratives to help our facilities navigate the troubled waters ahead? With this vision in mind, I'm happy to introduce our panel of experts that each bring a unique perspective to the industry. Joe Walsh. Joe is a progressive supply chain executive with a successful track record of leading procurement transformations at multi-billion-dollar organizations across multiple industries. Joe is currently the Vice President of Supply Chain for Intermountain Healthcare. Prior to joining Intermountain Healthcare in 2008, Joe held procurement and business strategy leadership roles at Foodbuy, which serves as Compass Group's supply chain organization and is the largest GPO to the food service industry. Joe has a bachelor's degree in business from the University of New York at Buffalo and a master's degree in supply chain management from Michigan State University. In 2015, Gartner ranked Intermountain third in its annual Healthcare Supply Chain Top 25. In 2013, Joe was recognized as the Contracting Professional of the Year by Healthcare Contracting News. To Joe's left is Jay Kirkpatrick. Jay has 27 years of healthcare supply chain experience and is currently the Western Region CEO for HealthTrust. In his role, Jay has account management, leadership responsibility for HealthTrust purchasing group members, and sales responsibilities for HealthTrust GPO and service line offerings. Jay served on the AHRMM Board of Directors from 2005 to 2010 and was the president of AHRMM in 2009. Jay was awarded the George R. Gossett Leadership Award in 2013 by AHRMM, and in 2014, he received the Supply Chain Leadership Award from GHX. Michael Louviere. Michael is the System Vice President of Supply Chain for Ochsner Health System in New Orleans, Louisiana. Michael joined Ochsner in April 2012. Michael is a past president of AHRMM and maintains his fellowship status. He is also a member of the Bellwether League's class of 2010 and received the AHRMM Leadership Award in 1995. He is a recognized international speaker and author in the field of healthcare supply chain and pharmacy. His past experience includes pediatric pharmacist, materials manager, chief operating officer, and VP of supply chain. Michael has a BS in pharmacy and an MS in hospital pharmacy administration, as well as an MBA from LSU. Preston Hall. Preston was born and raised in Erie, Pennsylvania, and after marrying, he relocated to Clarion, Pennsylvania, where he has worked selling cars and then handled purchasing for a juvenile rehab facility in Clarion. Preston joined Clarion Hospital in 1997 as a buyer and became the director in 2000. As the director of supply chain, he oversees supply chain management and central supply, and because Clarion Hospital is only an 82-bed acute care facility, he has overseen all aspects of supply chain from receiving, daily purchase orders, capital purchases, and maintenance agreements. He earned his BS in Human Resources from Geneva College, and he holds the American Hospital Association's Certified Materials and Resource Professional certification. He also holds the Institute for Supply Management's Lifetime Certified Purchasing Manager and certification from the Institute of Supply Management Certified Professional in Supply Chain Management Certificate. I'm going to start with our first question is going to be for Jay Kirkpatrick. With all the recent changes in the GPO landscape, can you share what the GPO's role is in helping member facilities unlock and then support their CQO efforts given the reform environment which your members find themselves in today? Jay?
Thanks, Alan. At the end of the day, we still believe that it's all about price and reducing supply expense in the big picture. So how we get there, if you think about it, historically, we were logisticians. We went from being logisticians to more of a financial supply chain where we're just focused on price at the pump. We're now moving in the CQO movement to more of a clinically integrated supply chain where supply chain professionals are going to not only be sourcing product, but also ensuring that the products are delivering quality and the outcomes necessary to generate the revenues for their hospitals and their IDNs, but also to improve patient care. So in my mind, Alan, GPOs really do have a responsibility for ensuring that we are contracting for those products that are ultimately serving the needs of our hospitals and ultimately improving care to our patients.
Okay. Joe, same question.
Yeah, no, I appreciate it. I think we all have to pause and think about the value equation. The value equation for any organization or any function inside an organization is always what is the sum total of benefits divided by the cost that we actually pay or incur for those benefits, which is coincidentally, maybe not coincidentally, the dimensions of CQO. So what are the costs that you actually incur for the quality and the outcomes that you actually get? So this is really relevant to this conversation because supply chain functions are now asking and being asked to actually really look at all three of those things, not just one of those things. In the past, it was all about price, and price is just a component of cost. And now I think the progressive supply chain functions that are in healthcare are looking at all three dimensions, C, Q, and O. And that's a really important concept. And as more and more supply chain functions start looking at the entire value equation, then of course the ask to the GPOs becomes a much broader ask. Price alone is no longer sufficient. And I believe that all the GPOs that are in the marketplace today, and we'll talk about what the name of the GPO and how that changes, but what we ask of the GPOs is what the GPOs will deliver and are capable of delivering and are willing to deliver. The GPOs are service organizations inherently, and they'll design solutions around what their customers are asking for. So if we, as providers, start asking for more progressive solutions, then we should expect our solution providers to actually kind of meet us at that point, that intersection of CQO. That's so compelling when we think about it from that perspective. What's really interesting is how GPOs, even today, in today's world, don't even like to be referred to as GPOs. They're casting rings of service around themselves that are much broader than traditional aggregated buying. So cooperative buying, i.e. putting multiple buying organizations together to buy together, is the foundation of how GPOs were formed with the interest of reducing prices and actually providing a more, let's say, easier sales and marketing channel for suppliers. That made sense. Is it still necessary? Yes. Is it alone sufficient? No. We have to actually have more comprehensive solutions that GPOs provide, which is why GPOs now don't call themselves GPOs. They're holistic solutions companies that offer anything from total supply chain solutions to even revenue management solutions, and the aggregated buying service is just a portion of what they do. So I think GPOs, historically speaking, have now had to catch up to where some of the hospital systems are. They've probably surpassed where many of the hospital systems are already today, and truly centered around CQO.